Hey guys, Dr. Berner with Foundation Chiropractic. Today I'm going to explain to you how we're going to fix anterior head syndrome. So this is normal. Now our head is literally a bowling ball. So the head's of course right up top here. The upper cervical spine, which means the top of the neck, is right here. Now we have these curves in the side of our back because we want to have the ear evenly over the shoulder, over the hip, knee, and ankle. That puts everything right in that neutral position to balance out our bowling ball head. Now, with texting, on average, people spend about 5 hours a day on their cell phone, which can equal up to 1 million pounds of pressure on those upper cervical ligaments, causing instability, dizziness, headaches, migraines, neck pain, a bunch of different problems, okay? So what happens when we're texting, we have whiplash, posture-related problems, we look like this. We have that granny hump, that hunchback, degenerative disc disease, pinched nerves, arthritis, bone spurs, lower back pain too, all because the curves are not in the right position. Your head is going so far forward, it's causing all this, making your head weigh a little bit more, but really, it's throwing your body out of the proper position. So today, I want to demonstrate cervical traction that we do in the office to help this out. We do this after we do the correction, so we make sure everything is in the right position, and then we gently stretch back over our traction wedge, okay? All right, I'm gonna have you lay on your back. So we place this right in the middle of the patient's back almost, okay? Come on down. And then she gently lets her head go backwards. Now right now, it's stretching out the front neck muscles. It's right in between her shoulder blades, and then her head weight, that bowling ball head, it's tractioning and decompressing. This is the opposite of texting and really the opposite of modern life. When we're texting, our head's forward, at the computer, driving. We do so many things where our head is going forward, and that leads to many problems. All those secondary conditions that we deal with, headaches, neck pain, dizziness, lower back pain, and that horrible granny hump that we start getting developed. So in the office, we do traction therapy, and then you get one to use at the house. So it's a continual therapy to make sure we stay in that right position and avoid unhealthy habits. So Dr. Berner, Foundation Chiropractic, Cervical Traction.